Hi, my name is Wendy, and I work as a licensed clinical social worker in private practice as a therapist. I work with individual patients. I do private practice daily. Usually I start at either 8 or 9 o'clock in the morning, and my last patient, I take patients hourly. I may start at 8 o'clock, 9 o'clock, 10 o'clock. I usually take my last patient about 4 o'clock in the afternoon. What I usually do is individual counseling with children, adolescents, adults. I have patients anywhere from right now I have a patient that's 6, and I go all the way up to my oldest patient is 82 right now. I do counseling on any type of topic from depression, stress, behavior issues, children in the school setting, relationship issues. I do parent-child issues, anxiety, or anything up to bipolar disorder. As far as the stress level of the job, it can get stressful when you're working with people and trying to help them work through issues and problems and trying to help them better their life, help them get better. But all in all, I really like what I do. I enjoy working with a different person each hour. And I enjoy seeing progress. To do the job that I have right now, I had to get an undergraduate degree. My undergraduate degree was in psychology. I enjoyed getting the psychology undergraduate degree, but I also had to go on and get a master's degree, and my master's degree that I got was in social work. But in many programs, if you start with a social work department, you can get a 4-year social work undergraduate degree, and then it's an accelerated degree to go into the master's program, and you only have to do, it's basically a total of 5 years, 4 undergrad and then 1 graduate degree. So there is a benefit to starting in the social work department. In my master's program, I had to have 2 internships. One I did at a state hospital and working with chronically ill patients, and one I did in a children's outpatient program doing counseling with children. And the advice that I was given when I did that was to your first internship do something totally opposite than what you really think that you want to do, because many times you might change what you think you want to do. When I went into this, I thought I wanted to work with children and adolescents in private practice or in therapy. You do therapy with children and adolescents. And so I did an internship at a state hospital working with chronic adult schizophrenic male patients, and found out that I really did not want to work with chronic adult male schizophrenic patients on a locked unit. So I did come back and I did do the children's program and really enjoyed. I knew that I did want to work with children and adolescents, but I do enjoy working with other populations. As far as licensure to be in private practice, you do need to go on and get your license. I have a license in clinical social work. I'm an LCSW. To do that, I had to go on from my master's program and do 2 years of supervision under a licensed social worker. So somebody that was an LCSW had to supervise me for my license. I had to sit for a test, an exam, but it's definitely worth it. It's a benefit to be licensed after you get your master's degree because you are more marketable as far as being able to find a placement. You are able to do involuntary placements into psychiatric hospitals if necessary for your patients. You can bill insurance for your services, which you can't do unless you're licensed. You have to bill under someone else. So there are a lot of benefits to being licensed. The best part of this job, I think, is having the patients come in and being able to work with different types of individuals, seeing a lot of progress being made, going from someone who is really having a hard time, really having trouble, maybe a child who's being kicked out of school constantly, and seeing progress made where the child is starting to really do well in school and staying in school and doing much better, or an adult who is suffering from severe depression and is starting to do much better and branch out and is not so depressed, or a college student who has severe anxiety and can't take tests and things like that, and all of a sudden is doing really well in school. To just to see the progress that's being made in the patients that you see every week, and to be able to see them move from every week to every 2 weeks to once a month, and that's just a big benefit of the job. To really feel like you're making a difference in the lives of people. But the worst part of the job is actually building the business aspect of it. To be in private practice, you're not just doing counseling every day. You have to build the practice. You have to market yourself. You have to find ways to bring patients in. You have to get your name out there and let people know that you've started a practice. I have to do charting every day. I don't just see the patients, but I have charts that on each patient, and I have to do notes every day on these patients. I have to wait for the money to come in. When I bill insurance, I don't get the money right away. They don't just pay up front because it's not an inexpensive thing to do. It's like coming to see a doctor. So you have to bill their insurance, and then I have to, before I can get paid, I have to wait for their insurance money to come in. So I may not get paid. I may see a patient on Monday, and I may not get paid for a month or a month and a half or so. But it's just building the business, building up the process. But I think the benefits for me outweigh the pros outweigh the cons. I think one thing that you should do now as a high school junior, senior, early college, one good thing would be to decide if working with people who have problems is a good fit for you. Maybe if you volunteer in different organizations, working directly with people, that's a good start. There are many different agencies. There are food pantries and crisis lines and just all kinds of different programs that you can get involved in to volunteer and just work with people and talk with people and find out more about the lives that people live. And if that's something that you enjoy, then this is the kind of job that you could go into. Definitely go as far as you can. You could stop with a bachelor's degree in social work or psychology, and there are jobs that are available, but you're very, very limited. The best thing to do is to go as far as you can. You're much more marketable with a master's degree and a license. My biggest advice is to go as far as you can. Another piece of advice is that you do have a lot of options. I'm in private practice with my license, but there are other things that you can do with a master's degree and with your license. You can work in other agencies. You can work as administrators in agencies that work with people. Just doing some research and finding out what your options are when you get into your social work program. There are many different options. Right now, I don't just do private practice. I do work with, I do mental health assessments on children that are involved with the Department of Children and Families. And I do mental health, or I do psychiatric screenings in the emergency room with patients who come in and have medical issues, but they also have psychiatric emergencies. There are many different options out there, but go as far as you can with school. Don't just stop.